Good afternoon. It is the 10th of September, the first post-Labor Day THCB Gang. I'm your host, Matthew Holt. Have a great lineup today with a new special guest, an old guest who's becoming a regular, and a bunch of regulars / old lags for THCB Gang. So who is on the show today? Well, special guest is Mike McGee. He's spent many years working at Pfizer. Since then, he's a medical historian, the author of Code Blue, which is an excellent book. He's featured on THCB a couple of times, and we'll probably have a book club with Mike coming up, but that's a secret you don't know about yet. Robin von Fanfanian, I can never get her name right, but it was close enough, who well-known author of a number of books, including Patience the CEO and all-around entrepreneur, an amazing person, and has just launched a new company she'll tell us about. And then three regulars, Kim Bellard, editor of the Late Limited Tincture and now regular at THCB, Vince Corrales from Better Health Technologies in the wilds of Idaho, and Jess DaMassa, my co-host at Health in 2.0, and of course the host herself of the best interview show in healthcare, WTF Health. All right, we can go live and figure out from everyone what has happened this week. So I will start with you, Vince. Busy week, and a lot of it not necessarily in health tech, but with implications for the world. So what do you?
Yeah, I'm gonna use some visual cues, so I'll just ask you to pay attention. A couple of months ago, two colleagues, Eric Paraxlis and Devin McGraw, and I wrote an article for the healthcare blog entitled 10 Reasons Why Contact Tracing is Uniquely Difficult. And some of those are fairly easy to discern. There are things like, well, this disease is just really hard. It's this amount of spread that occurs pre-symptomatically, asymptomatically, the lack of funding, the lack of federal leadership. Those are all part of the 10 reasons. So I'm here today, I'm pondering an 11th reason that I'm seeing occur over the last couple of months. And that 11th reason I'm going to label as simply defiance. Acts like Sturgis, where we have traced 250,000 cases back to that, and public health study shows $12 billion of healthcare costs. Weddings occurring in Maine and Minnesota with 200 plus people, 1,500 people on the White House lawn at the Republican National Convention. Those are examples of what I mean by defiance. And I don't have an easy answer, but it's a whole different level of, I don't know, frustration, concern. And some of that takes a different flavor, though. It's not quite as in your face as I showed you earlier, where we don't really have a systemic response, where defiance comes from college students who say, I'm not going to tell you who I've been in contact with because I don't want my fellow students kicked out or quarantined or suspended, or people in meatpacking plants or other places where they work say, if I tell you who I've been in contact with, you're going to quarantine them and they don't have any source of income. So that's my observation of what's been happening the last couple of weeks. It's a public health crisis politicized beyond belief.
Absolutely. Jessica, what do you notice the last few days, few weeks?
Well, okay, so I like health tech, and that's what I focus on in our Health in 2.0 show, which celebrated its 150th episode, everyone.
So
150 episodes. Oh my God. How can I put up with Matthew Holt for 150 episodes? I don't know.
2 minutes at a time.
2 minutes at a time. It's microdosing. But what I've noticed, I feel like the dial has been turned up on the big moves as far as funding, M&A, going public. Like, it just seems like headed into the fall, usually we see an uptick in activity anyway. But just this last 3 weeks, there have been multiple $100 million funding rounds. Like, and that to me, like, it just seems unprecedented. I mean, there was 2 this week alone. We saw Amwell price their stock to go public. This is like the 5th, I think, IPO of the summer. I've been keeping track on a little spreadsheet, and it's like the $100 million raises, we've had 13 since May. And those are just the ones that we keep track of, you know, for our purposes on the show. I mean, it's not scientific in any regard, but I feel like we're starting to see just money being poured into certain kinds of health tech businesses. And it really makes me wonder, you know, what's going to happen as far as some of these little smaller companies. And if we're going to see, you know, the emergence of seed companies the way that we did, you know, before, if health tech as a corner of the healthcare industry has kind of moved on from that and we're becoming more mature. I'm not sure. We even had a scandal this week, like a legit one. Like, so there is the former CEO of ZocDoc. There's like a salacious court case happening right now where he thinks the co-founders and the board has conspired against him. And it's like, what has happened to health tech? You know, I mean, and even some of the money that we saw with SoftBank money is back in. Like, what is happening here? I mean, we're in unprecedented times. So I feel like, I don't know, this week, this post-Labor Day has just, I don't know, slammed, you know, the foot on the gas as far as money into health tech. And it's like, it's already been a dynamite year. I can't imagine what's going to happen in the next couple months.
Right. Mike, we'll get into, I'll introduce you in a bit more in a minute, but just in terms of stuff you've been noticing the last week or two, what's been on top of your mind?
Well, you know, coming on board, which thank you very much for inviting me. I'm surrounded by people who know infinitely more about health tech than I do. Although over the years, I've been tangentially involved only from the standpoint of I tended to work in the social science arena with sociologists when I was in Philadelphia. And one of the things we were focusing on is, well, what was the hidden value of health professional relationships, of doctors and nurses making in-present physical contact with literally hundreds of thousands of patients as a collective across America each and every day. Well, what was the benefit of all of that? And when we studied it in large scale surveys, not only in the US, but in Germany and South Africa and Japan and elsewhere, we found that there were 3 things that people tended to ignore. Number one, as a collective, all these doctors and nurses with hands-on contact with patients process a society's fear and worry. They dampen down fear and worry, sort of the opposite of what Trump has done, which is to ramp it up. And as a result, that has a stabilizing effect on society. The second thing is subtly, doctors, nurses, and other health professionals reinforce important family and community bonds. They're basically all the time during their histories and diagnostic procedures reinforcing the connection of an individual patients to their loved ones and to their community, which is of value to society. And the third thing is they tend to lean toward reinforcing trust and confidence in the future. And in so doing, they are encouraging people, without saying it out loud, encouraging people to take a risk on the future, to invest in education, to invest in the possibility that things may go well. So when I was joining you, what was going through my head is, for all of the important things like connectivity that health technology can do, what is the result if we're unable to actually make physical contact in the future? You know, what would that feel like? And how would society deteriorate if we're not able to actually hold each other and hug each other and trust each other and manage each other's small fears and worries? What happens if they accumulate? Would that destabilize our society? So that's what was going through my head.
Wow, that is a huge thought. But I mean, obviously you've got both technology, but also COVID playing right into that. And that's just in healthcare. And before you start thinking about education, school, and community and church and weddings and everything else. So yeah, we'll get back to that. Fascinating. All right, Kim, just the last week or two, what have you been looking at?
Well, there's a lot going on, but I have to say, it's what we were talking about before we went live. I'm just gobsmacked by the fires and the atmosphere in the West Coast there. It's just astonishing. And I think about, all the once in 100-year stuff that has happened this year. There's been a lot of it. And now I'm all of a sudden a lot more worried about this asteroid that may hit in November. It's like after the year, I have to say. So, I'm dreading what happens the rest of the year, because like what else can possibly happen?
Those 2020 bingo cards are getting filled out rapidly. Robin, you have had a busy last couple of weeks, because the last time you were on here, you were this patient entrepreneur, patient CEO, and now you're a real CEO again. So why don't you tell us a tad about tell us what have you noticed, and just mention, we'll get back into it, mention what the new company does.
So yeah, we co-founded a company called Face Touch Aware. It's with the very famous neuroscientist, David Eagleman, if you probably heard of David, Don Vaughn, who's also a neuroscientist, and Sarah Vaughn, who is a physician. And what it does is it just alerts you when you touch your face, so that you can be aware, and then you can break the habit. Because we know that touching your face is one of the main ways that you can actually contract a disease, right? You're putting infectious agents near your mouth, and your nose, or your eyes. And so we really wanted to make a small difference in people's lives during the coronavirus. So we created the Apple Watch app and just launched it last week.
Fantastic. All right, we'll come back to that a little bit and talk about your journey there. Anything else you've been so heads down? Is that what you've been looking at the last couple of weeks? Something else that crossed your fancy?
Just exactly what Jess was saying. I mean, she was spot on with these huge, massive deals. And that really helps play into a big keynote I'm giving in a couple of months for every single hospital system and healthcare system in the United States. They're expecting 2,000 to 2,500 of the CTO and the CIO departments. And I'm really going to try and convince them to shift their healthcare into the patient's home as well. And these giant $100 million rounds and things like Amwell filing to go public really help me prove that point, so I can teach these hospitals how to develop new revenue streams and keep up with the Apples and the Amazons in the patient's home.
Yeah, we'll talk a bit about that. All right. Well, as usual, my weekly takeaway is much more salacious, since the reporting this morning that my favorite CMS administrator, well, the only CMS administrator, but Seema Verma is back in the news because basically she was paying right-leaning PR agencies to get her into the news and the press and what have you. And there's been another report out from the Democratic House Committee, basically showing how much public money she'd spent. And I was just astonished the report didn't include anything about the time when her car was broken into in San Francisco and she had $47,000 worth of jewelry, which of course anybody else would be carrying around at any time. Stolen from a car. I know, Robin, you carry much more than that jewelry when you're roaming around. Stolen from a car, including the Ivanka Trump line of diamond pendant, which it was worth like $5,000, but allegedly worth $5,000 by itself. And she tried to get the taxpayer to pay her back for that. And I just thinking about in a microcosm. I mean, I know she's not the worst, and I know that there's all this terrible stuff going on in many public agencies under this administration, but just the sort of level of venality and grift and self-promotion that occurs all over the administration compared to some of the amazing honorable. You think of the Don Berwicks and the Bruce Wax and people who've had that job, and now even Mark McClellan who was on a webinar that Carlos Delta was doing the other day, and now we have basically this grifter from whose sole qualification for the gig is that she is a right-wing extremist who knows Mike Pence. I mean, it's a sad one. Another grifter in the
grifter.
How can you imagine that? All right, so let's start. I was just actually let's get into the meat of this. I was really thrilled by what Mike was saying. So let's get back to that, because I think that's a great topic. So Mike, of the sort of lack of contact and the role, the sort of sociological role that the medical profession and the consumption of healthcare services has, that does a number of things. And as you mentioned, makes you confident about the future, probably makes you more confident about science. I'd be interested in hearing how much do you think that has been. I mean, there are a number of factors, and you've written a lot, obviously, in your book Code Blue, about this, about the sort of the financial rise, as it were, of the medical industrial complex and the financial imperative behind it, which a lot of people would argue has sort of hurt the doctor-patient relationship over the years. But also we have technology, and then also we have the lack of the ability to get out because of COVID, especially the early months of the COVID crisis. Where would you say we are in the kind of that driving a wedge amongst sort of the its role, the role you just mentioned of it being sort of sociological calming influence.
Well, there was a great article just yesterday in the Atlantic, and they went over all of the major things that we've done wrong with where we are today on this crisis. And they were talking basically about two pandemics, one pandemic being COVID-19 and the other pandemic being structural racism, and got into a discussion of how these crosshairs at the Medicaid programs and how that's been the case since its origination, first under Kennedy's push and then Johnson, AMA resisting it, Southern states feigning participation, and then in many ways undermining it, and how today, when you look back, almost the same states that resisted it in 1965 resisted today with 12 states remaining. So they were raising the question, how much progress are we making? And they went through, all the things that have gone wrong, obviously, with this crisis. My point of view on it is none of us should be surprised at the fact that the system immediately collapsed under the weight of this pandemic, primarily because there is no national system. What we consider a national system is actually a series of medical industrial complex guilds that have their government relations offices next to each other in Washington. And if there is any national coordination of healthcare in America, it's the fact that the various different government relations departments of the AMA, the AHA, the AAMC, pharma, insurers, and so forth, coordinate and collude in doing their government relations planning, mainly to protect the status quo and the flow of income to their members. That's the truth of the matter. So we should not, number one, say this is a national system. We got no national system. Secondly, we have no strategic planning or public health basis for strategic planning in the United States. So whether it's at a time of crisis like now or everyday living, there is no prioritization or budgeting or a rational approach. We've just let it all hang out there, and it's kind of this predatory capitalistic system, which has become, amazingly sophisticated in terms of legally sharing behind the scenes funding with the PBM. So what I tried to do with Code Blue is to say, hey, the way this thing is set up, we are really vulnerable. If ever there is a crisis of mild degree, this system is going to collapse because it has no inventory management. It has no way of moving either materials or people or supplies amongst the various entities. And as a result, everyone's going to be hanging out there on their own, as we first saw in New York City when that whole system collapsed. So I basically am saying this could have been predicted. Now, this COVID thing is worse than a mild insult. And I think the article in the Atlantic today made the case that one of the big mistakes we're making is that we were thinking of this in terms of months. And they said we should have immediately said, this is at least a 2-year event. Mm-hmm. And so we've got to plan that way. The problem is we've got no real system or governance to actually think and plan 2 years out. And if we're going to make it, we've got to make it right now as we're being challenged.
Yeah, I mean,
here's a scary coda to that. The big pharma companies got together and said, we're all going to make sure that the vaccines get done right or whatever. So we now are trusting pharma,
right,
more than trusting the FDA and the CDC. And if that isn't an indictment on the healthcare system, I don't know what is.
Yeah, I mean, there are two things I'd point out. One is Eric Topol, wrote a great open letter to Stephen Hahn, the chair of the FDA, right, basically saying, what the hell are you doing going out there spouting stuff that we know isn't science? This was about the blood antigen stuff. And then the second one is that there's just a report combining what you mentioned about Medicaid, Mike, and what I was going to about Seema Verma. Her main Medicaid plan has been to this you have to get a job before you can get on Medicaid, and the reports just come out about what happened in Arkansas and how cruel, inefficient, and ineffective that was. I mean, You know, and it seems to me you're right. We've got everything in the system going against what you're saying. Robin, I'd love to talk to you about as a patient perspective regarding, now, you haven't always had the greatest time with your doctors, but what do you think about Mike's overall view about the interaction between doctors and patients and doctors and the medical systems that are helping be social cohesive?
It does actually, thinking back, especially to the time when I was really, really sick. So for those who don't know, I have Crohn's disease, 43 hospitalizations, 6 major surgeries, and 3 organs removed, including my entire large intestine. And so there was a 3-year period in my 20s where I was a shut-in, right? Like I could barely function. Like going to the grocery store 1 time a week was as much as I could handle. And let me tell you, back then I actually looked forward to my doctor visits, because it was that 1 time every 2 weeks or 3 weeks maybe that I would actually leave the house and interact with people and feel human touch and feel like I was in the presence of someone who cared about my well-being and was going to help me, because I really needed a lot of help back then. Now, of course, I'm much different and I just tell the doctors what to do over phone, but over email. But when you are really sick, it does make a big difference to be in the presence of someone who is like an authority figure, like a physician who can help you.
Did you have a sense that you came in and left those offices with a sense of hopefulness? Did you connect with the fact that your doctor thought that even if you didn't have a solution today, there might be one tomorrow? What was going on in terms of hopefulness?
So no, I mean, that's why my first book, The Patient as CEO, How Technology Empowers the Healthcare Consumer, one of the big messages is technology is hope. That was the thing. I would never have had all those surgeries and lost 3 organs had my doctors actually looked ahead even 4 or 5 years. Mm-hmm. Now, like if they looked at the phase 3 clinical trials for Crohn's disease, they would have seen this blockbuster coming out, and which is the one I've been on for 20 years. Nobody try and do the math.
We know you're only 24.
Exactly. I'm just 24 still. But they never did. The only time I got any type of hope from a doctor's office was after I fired my healthcare team, took control of my healthcare, and then rebuilt it. And I was in charge. And I went to a new endocrinologist because I was on steroids for I think 13 years straight, prednisone, and I couldn't get my adrenal glands to get off of it. And he gave me a lot of hope, because he was like the 6th endocrinologist, and I've been trying to get off prednisone for like 5 years by then. And he's like, I have a whole new system for you. Let's try this. Let's go down 1/4 milligram every 3 months. It's going to take you 1.5 years to get off this, and it's going to be hell, but it will work. And in addition, here, take this and this. And I got off of it. And that is huge, because I mean, prednisone, being addicted to it, you start, you get what's called Addison syndrome or Addison disease. And so your adrenal glands stop working and stop producing their own cortisol. And that's a really big deal. You die without that. And so I would have been on prednisone potentially the rest of my life. And by now I most likely would have had like a broken hip, because it destroys your bones, your jaw. And not to mention, it makes you a lot more, things like COVID, like you can catch COVID more easily because it's suppressing the immune response.
So Robin and Vince, I'd like to ask you specifically, because you started off with the whole idea of saying, giving the 11th finger to science, as it were. I mean, Mike sort of raises an interesting point that we used to have, maybe it was halcyon days, maybe it wasn't true. There are obviously lots of problems, as Robin's just discussed. We used to have this sort of society where we had the idea of authority figures and science, and if you go back to sort of the New Deal in the 30s and the Second World War and the stuff that rose into the Vanderveer Bush stuff and the sort of technological imperatives that you talk about, Mike, in your book, we had an idea of progress. And now we have QAnon and conspiracy theories and, craziness going around about and rejection of a lot of this. I mean, Vince, you've been doing this for a long time. Do you think Mike was right about what life was like? Was like, and it's gone away, or
you mean can we make America great again? Is that what you're asking, Matthew?
I don't know. Was it ever great? I'm not great is the wrong term. You know what I mean? Was it ever a society where we were sort of confident in scientific progress and all of us were going along, like perhaps maybe South Korea or Singapore is now?
Well, I do think it truly is different, and back in the 50s, 60s, 70s, or even before that, what we didn't have was the onslaught of social media that increases the pace of communication and the amount of communication that is occurring and allows the spread of disinformation. Boy, there's so many connections I'd like to make among all the different things I've heard in the last few minutes. I'll try and make a couple of them. So, Mike, I think the balance is already occurring. What we had statistically was 69% of visits were through telehealth in April, and that was down to 21% in July. So the pendulum is coming back, and I label what you're saying as what we really. I always use the word that in the U.S. we have a non-healthcare system. It doesn't exist, and to weave a thread with Jessica, what you were saying was really that what we've got is really a free market, and that it's increasing in investment, which is not at all surprising. I think we spent the first few months thinking about what's the new normal in healthcare. And what I'm discerning is the new normal is really a large acceleration. That's the simple word that describes it, an acceleration of existing trends. And much of that is driven by technology. And Robin, I think just to weave in what you were saying, I think your story is amazing. I've had no idea about your background. And the question I'm left pondering is, is there a way to get Joe the plumber to take on that kind of responsibility and engagement, fire their healthcare team and take it on themselves in the future? I think we'll see more patient engagement, but can we really make it spread even through technology? So a number of scattered responses. Again, hopefully a little synthesis and a little bit of optimism, Matthew.
Well, I mean, that's an interesting one. I think it comes back and talking about Joe the plumber. Jess, you moved from the Bay Area halcyon of independent sort of investment trading, computer programming, whatever the hell we do in the Bay Area, to Chicago, kind of middle America, right? We hear a lot in the election about the Midwest. We're hearing a lot about people you haven't moved there. We're hearing a lot of people who have moved there, and about people leaving the coast, and then the sort of, whether it's true or not, this conflict between the coastal elites and the Midwest, and you hear a lot about this stuff. What are you picking up on what Vince said and what Robin said? Do you think Joe the plumber? I think Joe the plumber was from Illinois or something.
Joe the plumber lives next door.
He probably does. He's probably next door. What's your sense about Joe the average person, the average person?
Joe, my neighbor.
Joe, your neighbor. Joe the plumber, your neighbor, becoming a more a more aggressive patient, a la Robin, versus the sense of the country going that we can't, the rate of progress, and how much of what we've seen in terms of the QAnon stuff is a rejection of the rate of progress that has happened out of technology and in the coastal elites, right? At least the coastal elites who own enough Google stock or whatever.
Okay, I'm going to clarify first of all and say Chicago is not the middle of nowhere. It is the third largest city in the
middle of America.
I am in a suburb of it. Like, there is a Chicago land area, and that's where I am at. So I am at my parents' house. So I can report fully on the I can report fully on the Italian American community and their embrace of healthcare here, where I'm at. But to answer your question, I think that what's been interesting to see here, there is a definite difference between, even just with the mask wearing, social distancing, some of the precautions that the government has, like the city governments or the county governments have put in place. There is a marked difference between what I experienced in California and the Bay Area and what is happening here in Chicago. And so I feel like people are a lot more comfortable with just going back to work. Like, they really got that blue collar, like, let's just get it done. I mean, it's a city of big shoulders, that's a nickname for Chicago. And it's like, it really is that. It's like, we're just going to tough this out. You get sick, you stay home, you take care of each other. What has been interesting is I have seen on TV more commercials for things related to diabetes and diabetes management than I have seen in a lifetime. Like, I saw literally a commercial for a Dexcom glucometer. I blew my mind. I'm like, on TV. So I was going to say, and jumping off of what Kim was saying earlier, earlier, you know, how the pharmaceutical companies, it's like, you know, everybody's looking to them at like, okay, great, handle this vaccine process because the federal government isn't doing anything. I feel here like there is this real sense of looking at trusted retailers and trusted, you know, like trusted means of how you buy other things, really that healthcare consumer piece playing a bigger role here than I feel like I see out west. So like Walgreens is the hometown pharmacy here, and I think people really look to Walgreens for care. And I was actually just on a call with a colleague who works for works for the biggest payer in all of Florida, Blue Cross Blue Shield of Florida, and we were talking about the new Walmart supercenters that are opening, you know, in Jacksonville, and what that's going to do to the lock that some of these you know, these other clinics that are run by the health insurance plans or the hospital systems there are going to do. And I think you can't undercut the role of retail in all of this as being a force for not only like popularizing the way people take care of themselves and their health, and like introducing them to new things. And you know, like the as seen on TV aisle, like there's the Dexcom thing now, right? And even bigger players like CVS, I mean, I've done work with them as well, and I mean, they're partnered up with Salesforce, so it's not even just in the home. I mean, we're talking about like work, like they have a nationwide testing strategy, whereas the federal government does not. Like, okay, so I think you're going to see, I don't know, one of the things I've noticed here, Matthew, to answer your question, I feel like people are looking at traditional players, and they are not looking at the government, and they are not looking at the traditional healthcare system to solve these problems. They are very much focused on, you know, building out that, I think, that consumerism piece of healthcare.
So I mean, more broadly, and I'll charge in. I mean, how Robin is not typical. We'll give her that. But how atypical is Robin? You know, and where do we think Middle America, whether it's a place or an idea, is in that transformation?
How far is she? I mean, like Robin is like a patient extraordinaire. Like, I mean, I think you have to deal with a little bit of Chicago attitude here. I mean, you know, it's one of those like, they're not going to take any BS. And I think there's a little bit of skepticism about technology and big companies. And there's a little bit of that. I mean, but I think, you know, overall, I feel like people are very much interested in being responsible for themselves. That's the vibe I get here. And they're not looking, they're a little bit less inclined, I would say, to look toward, the government. I'm trying to word this so carefully. Look toward the government in the same way as like in California, I think we have much more of a bent towards socialism than I think we do here in Chicago. So I think that people
having lived in a country which was vaguely socialist at one time, California's nowhere near socialist, but I take your point.
No, you know what I mean? Where it's a little bit more like there's more of a group mindset. There's more group think, and I think people are more on board with like, okay, we're all in it to help everybody else. Whereas I think here things are everybody's a little bit more individualistic. There's like a hint of republicanism.
I don't think it's a geography thing. I think it's more of a socioeconomic thing. You know, the essential workers, the people that are, you know, struggling to make ends meet, they don't have the time or energy to manage their health in the way that, you know, the 1% or the 10% do, or whatever. So as in most things, you know, college educated, you know, well-off people tend to use technology more, tend to take care of themselves more, tend to be in better health result. It's the people that are living, you know, paycheck to paycheck, if they're lucky, that the system fails totally. And that's, you know, amply demonstrated in all the health statistics on COVID and everything else. You know, we're failing them as a nation in every way.
I mean, to speak on that other pandemic, you know, the south side of Chicago, the structural racism that has been in place, that has perpetuated the gang violence there. I mean, that's their legit healthcare concern. So I'm out in the suburbs, and it's a very different situation than what's happening there.
Yeah, I think the educated, engaged patient not only does better themselves with their families, but it's also an easier patient to take care of. But the loss of the ability to trust is a big problem. For example, I'm old enough now and have been through enough things to know that when I get in trouble, if I've picked the right person to take care of me, when I'm there laying ready for the procedure, I close my eyes and I trust. Now, if I didn't have the ability to trust in other human beings to help me out, I wouldn't be able to close my eyes. I'd be scared to death, right? And so it's kind of a delicate balance. You know, a lot of times being a doctor and having grown up in a doctor's family, you have all sorts of people who turn to you for advice when they're in trouble trying to figure things out. And so that kind of informed help makes for an educated consumer. They know who to go to. Sometimes they know what questions to ask. Other times, and they come back and run what they learned past you, and they kind of figure it out. So it's kind of that extra help that everybody needs in order to make it over the gap of not trusting other human beings. But I don't think the end goal is a society where we always have to second guess each other. The end goal should be that we take care of each other. But in our culture, it's a dog eat dog culture. That's what we have trouble admitting to ourselves. This problem that we have with healthcare is a cultural problem for the nation, always has been. The reason why we still have structural racism is a cultural problem. It's not a healthcare problem, but it affects the healthcare of people who happen to have been the victims of structural racism. So, you know, if we're going to have a turning point now, if we're at a tipping point because of the crisis we're enveloped in, the tipping point has to be cultural. It's not as simple as just going out and building a healthcare system, even if we had the will. You've got to have cultural change to actually be willing to address the question we've avoided all these years, which is, how do we make America and all Americans healthy? It's a simple question, but it's a profound question. And it's never, ever, ever even been raised in this country, let alone been addressed.
I want to go back to something that Vince said before, that I think getting that kind of cultural change is harder than ever because of social media. People live in cocoons of their like-minded people. So there's no national news, there's no national point of view, there's no national facts. Everybody looks at their little, you know, the people that think like them, and they don't break into other silos. So bringing about a broad-based culture, I don't know that we can even do that anymore. It scares the hell out of me.
Well, we got to, you know, we've got to develop the ability to take care of each other.
Well, I mean, I think
that's at the core of it.
There's 3 or 4 things at the core, and that's the core part, right? Which is a sense of community, and a sense of, and that some way comes back to a sense of belief in science and scientific progress, and you know, and not and there being one truth, right? And which is some of the craziness we're seeing now around the conspiracy theories and being exaggerated by the current occupant of the White House is not helping. But I go back to the, you know, to my original optimism. So I was at Institute for the Future in 1993, one of the first people looking at the sort of the use of the internet, well, with a group of people who I'm the first looking at this explosion of mass media in the 90s, and we kind of all believed then, well, the prevailing belief was that the community and the crowd was sorted out, right? The crowd was in the end going to be having its wisdom, and that most stuff would get corrected, right? And that was what, if you go back to even the 2000s, like Clay Shirky and the wisdom of crowds and all that kind of stuff, that's kind of where we thought it was going to come out. What I don't think anybody anticipated was the splintering of the crowd. How you can splinter off a small percentage of people and influence them by any means necessary. And somehow or other, we've got to get back to a concept where education, I don't know if it's education or following the right people, whether it's your doctor or influencers, I don't know. I don't know what the right solution is, where people are starting to thinking about, how do I do, where kind of we were when I go back to the 30s, 40s, 50s, 60s, we talk about where there was a belief that things were going to progress towards a particular sort of idea of scientific and economic progress. It may not have been great for everybody, but at least we had an idea that it was going that way, rather than believing that, you know, half the country or some chicks in the country was out to get us. And that comes into what Mike just said about, you know, people taking care of themselves. We don't, I mean, Robin, the last time you were on here, you were talking about all the things we ought to do, and that you actually do that. You're probably the one person in America who does it, right? Eat right, exercise every day, you know, live a healthy, de-stress. There are all the apps and solutions, and there's more you could possibly written about ever, but we know that no one does that. Part of it is because, you know, when you go to school, another area where we're having a lot of problem with COVID, because going there, is you don't get taught that stuff to kind of maybe you didn't get taught it 50 years ago, but you're certainly not getting taught it now. You're not getting regular PE. There isn't a lot of great education about how to eat better, how to live, how to live your life better. There's some stuff sneaking in. There are some programs I see around that in the education system, around mindfulness and stuff, but I don't see as much as I think we ought to see. And meanwhile, commercial America, business America, the agricultural lobby, the food lobby, the exercise lobby, the gaming lobby, the entertainment lobby are all far the other way. What can they do to keep you sitting still in front of a screen like we all now are, eating sweet junk food, but all the above. And I think that's something that I don't know the healthcare system can combat, but as a broad strokes, we've got to at least have that discussion. And I don't see where we have that in the current, I don't know where that's happening in the current environment. I mean, other than this highly, intellectual show that we're putting on here, which is probably not reaching the millions of people it needs to get to. Maybe I'm just being pessimistic now. Someone cheer me up.
Well, really what it comes down to, though, is that patients forever, up until even right now, they were never told that they're in charge of their healthcare team. They were never told that they were in charge of their health. Up until now, it's been a very paternalistic system, right? You walk into the doctor, they're the authority. You don't even call them by their first name most of the time. I call almost all my doctors, by the way, by their first name. But, occasionally it's a Dr. Smith. And so you already set that relationship up that the doctor is smarter and better and the boss of the patient. And that's not the truth, because a doctor's appointment is 7 to 12 minutes if you're lucky, and they see you once a year. That's not enough to actually be in charge of your health. So the first step is really both the doctors, but the healthcare systems telling the patients they're in charge. And so now that I say that out loud, I would love to partner with like a CVS or a Walgreens or a Walmart, and in big letters by their pharmacy and by their services. With Walmart, they're even offering dentistry, and it says you are the CEO of your health, right? You are the one in charge of your health. And then here are 5 different pamphlets that you can take that will help you get there.
Yeah, actually, just one point exactly on what you're saying, Robin. I was doing a podcast with a guy called Matthew Zachary. He's a cancer survivor, was a teenage or early adult cancer survivor, and he was featured in the Health 2.0. And we kind of went back through the litany of the early patient communities online, going back to the early 90s, and even all the way back to Our Bodies Ourselves, the Boston Women's Collective in the 70s. But certainly, the cancer, the AIDS patients and the cancer patients online in the early 90s, and the bulletin boards and what have you. And if I was to say that of all the technological progress, all the stuff we've seen, yeah, it's been too slow, and yes, telehealth took forever to get here, and yes, we haven't seen the changes we'd like to have seen, and all this technology that I've been pimping for years with Health 2.0 and elsewhere hasn't really got there. The bit that's the most disappointing to me is that all those patient communities, which were now, they went from the bulletin boards and ACOR and stuff, they went on to Yahoo, they went on to Patients Like Me, they went into now Facebook groups, and there's all that incredible amount of information and ingenuity and self-support there, has not somehow met into the healthcare system where it's an accepted part of how we provide care. I think that's a huge missed opportunity, because there's so much knowledge among patients. And the problem is it's now got crossed somehow in some weird thing with a bunch of science denying consumers, the anti-vax movement and some of the other stuff that we've seen around there, some of the aggressive stuff we've seen, which we know is going to make coming out of COVID harder. And that obviously has a lot of connections, cross currents, Vince, with your people with their middle finger up to wearing masks and all the rest of it. So now I'm even more depressed. Okay, someone has got to cheer me up before we go.
I'm going to tie together Robin and Mike. That Mike earlier used the expression about the guilds, talking about the lobbyists, but for a long time, I believe that the medical profession has actually been a contributor to this. They set themselves up as a guild. I'm wearing a white coat, I'm in charge. And if you go to somebody wearing a white coat, it's all good. So they didn't really ever go out like, there are good doctors and bad doctors. There are good medical schools and bad medical schools. We'll help you find the ones that are good and get rid of the ones that aren't. Instead, they exist primarily to protect the people that are in the guild. And I think that's been a problem, and it's been a problem for patients that, how do you find which doctors are doing a good job? How do you find the right measures of quality? Doctors should be the ones leading us to this, but they're the ones that are in most cases covering it up, if anything.
Well, there is there's a rich history that goes back 70 years, really taking off during World War II, that kind of set this all in motion. When I wrote Code Blue, it was primarily to try to figure out how did this system, which is different than any other system in developed nations around the world, ever take hold here? And why did it take hold? And why has it lasted as long as it has? But knowing that doesn't necessarily fix it, but it at least lets you know what you're dealing with. And on the positive side, when people ask me, well, isn't Obamacare a total failure? When I look at the ACA, I try to remind people that what it has accomplished, even though there were so many giveaways that we're still dealing with them, is three things. Number one, it established a basic benefit package, which everybody agreed to are the basics that you need for real insurance. It's the reason we're able to say that these HSA tinted skimpy plans suck. So an agreement on a basic benefit package, that was a big deal. That's a big achievement. Secondly, it established that people will not stand for bias against pre-existing conditions like yours, Robin. So that, again, that was an enormous accomplishment. But
I just interrupt, Mike. That's the one where Trump has now claims that he's written that into law. Even
right.
Bizarrely, even though he's in court now trying to overthrow the act which does it.
And then the third thing is, people forget, we now know that about 70% plus of Americans support universal health care as a human right. We never had that to fall back on before the Affordable Care Act. So, I think we build on those three things. We are probably, one step away from a public offering of some sort that would be open to all. And we'll see, whether there'll be a mass subscription to something like that and whether it triggers a national health care system. But what I'm saying is, we have made progress. That said, we've got to confront the fact that there are large numbers of Americans who still believe if I've got mine, you don't need yours.
Well, to that point,
that's got to be confronted.
Two of those three things the Trump administration has undermined by allowing the sales of these skimpy health plans in the short-term health. They don't have to do the basic health benefits, and they cover pre-existing conditions. And now Georgia wants to sell them on their own exchange right next to the exchange plans as though they're entirely comparable. It's a very Machiavellian way to undermine coverage for pre-existing conditions.
Swiss cheese.
The healthy people go into those plans and the sick people go on the other plans, and the rates skyrocket. I mean, it's terrible.
Well, we're going to have a lot of trouble
all the time. Do you guys, you must, do you guys get phone calls during open enrollment with people in your life like, hey, can you help me pick out a plan? I don't know what any of these words mean. Do you get phone calls? I get phone calls constantly. Yeah. Truly, it's like open enrollment happens. I know a lot of self-employed people who are buying off the exchange. I get called all the time. And I'm explaining premium, deductible. So it's like, and these are educated people who are running their own businesses. They've got, they've got the ability to do that, the wherewithal to do that, the education to do that. But it's like to pick out a health plan on that exchange is so hard. You have to literally phone a friend.
I worked in health insurance and I do not understand the drug coverages.
Yeah. Right. Oh, nobody does. Nobody does.
I've been in healthcare for 30 years, and about 10 years ago, our health insurance for just me and my wife hit over $2,000 a year. That's when I got my own agent. That is my single best piece of advice. Get an agent who understands this stuff.
You're only paying $2,000 a year?
Yeah, right?
That was 10 years ago.
I pay $800 a month.
Oh my God.
Oh, I know. It's gotten, it's gotten
That's
worse.
Almost $10,000 a year. I spend just in health insurance.
Don't forget, everybody, the numbers are the average American family is paying $27,000 a year, of which their employer is paying $18,000. They're paying a balance of the rest. Now that's average, so it varies up and down, and that matters more if you work for the Olive. What did the I forget who said this, but somebody said it depends whether you work at Apple or at Applebee's. It's a big difference. But you know, we know it's very, very expensive, and that comes up. But I mean, what the ACA hasn't done in any successful way really is contain the cost. And although it did increase,
and it wasn't designed to.
We know it wasn't designed.
Wasn't allowed to.
Look at it and compare it to what's happening now with our inability to get people on the same page with wearing masks. Okay, this was like landmark that they were able to get that much support around this one piece of legislation, imperfect as it may have been in the end. But that like stands out to me now.
Let's not forget, it needed 60 Democratic senators to pass it. And don't forget, we lost one in the middle of it, so they had to pass the House's. The House had to pass the Senate's version of the bill, and they never got to do the compromise. And that's why all these weird lawsuits are there, because there was, you know, junk legislation, and the junk lines of legislation never got edited out. So that one, and you know, more importantly, it was, as Mike started, there was a lot of bribery, giveaways, and corruptions, both to individual senators, but also to various members of the medical industrial complex to make sure they would be on board and wouldn't oppose it.
Well, the how and the why of this is really fascinating because the historical record actually shows the progressive dismantling of every important check and balance on this system. The thing that kept these various guilds from colluding with each other was systematically taken apart, and it's continuing up to the present day. I mean, how, you have to ask yourself, is it legally possible to opaquely provide kickbacks to each other and have everybody in on the deal except the patient when you go and fill your prescription? How would that even be conceivable unless the control on the systems had been dismantled? And so the reverse of this is, obviously, if we've got 4 more years of Trump, there's hell to pay with this thing. But if we do have a change in administration in the midst of this life-changing crisis that we have, we may be reaching a tipping point. We may be willing to reassert some of the checks and balances that are needed to bring the thing under control. But the core issue that's going to be the most difficult of all to deal with is, if we were to go with the national healthcare system, who's going to govern that? What body do we trust? You'd almost have to invent that all over again and figure out, because all we've done in the past is backfill it with a couple of members from the AMA, a couple of members from AAMC, a couple of members from pharma, from AHA. That wasn't representative of patients. We would have to figure out, well, who can you really trust? Who is capable and trustworthy to run a national healthcare system that involves annual prioritization and budget control? That's a difficult question.
That's a very hard question, even countries where they have figured out a national healthcare system. What's the fighting of that? And it's worth mentioning that the IPAT, the Independent Payment Advisory Board that was set up in the ACA, right. To manage excess costs, got squashed, got abolished, right, as part of the process.
And there was a reason for that, because it basically challenged, the guild system overall.
Right. Eventually said, so I think I have a big piece and a little piece of that. One of the big pieces, you've seen over the last decade, particularly, but the previous decade and a half before that, this integration between hospitals and medical systems, who basically become price makers, hospitals, medical systems, physician groups, and why you've seen the price, and go back to Uwe Reinhardt's great piece of, Joe Anderson's great piece of nearly 20 years ago now, it's the price is stupid. We know the prices per service here are dramatically higher than they are in the rest of the world. And we've seen prices increase because of the monopoly pricing power of local systems, and they continue to grow, right? I mean, they continue to grow within states and across state boundaries, and there's no real antitrust about that yet, on the one thing. And then you see all kinds of entrepreneurs trying to figure out either how to make money off the weirdness and the sort of price fixing, and one of them is about to go public in the next couple of weeks, GoodRx, which, if you look at it, makes its money. And they launched a Health 2.0, so I should understand what they do, and I know Doug Herschel, the CEO. But in the end, They make their money because there are deals between the PBMs and pharmacies that on patients who are not covered by that PBM. There's still a deal. If they can root out the deal that's better for the patient standing in front of the pharmacist right then at the desk, you know, the pharmacy counter, they can make a cut on that arrangement. And that is just good enough to make them the only digital health company going public that is massively profitable. All the others, Livongo, Teladoc, everybody else, American Well, are losing shed loads of money, but GoodRx is putting 50 million plus, you know, straight to the bottom line every year because of this weirdness that you brought up, Mike. It's the way that PBMs and pharmacies have this sort of conjoined mess of a system that, you know, clearly is not favoring the patient or the person paying the bill in the end. Well, we are rounding away. Okay, we are close to an end here. I'd love just to go around and wrap up. So first off, before we go though, Robin, the new company, before we get to the wrap up, the new company, FaceAware, tell me the obvious question. It works on the Apple Watch. What happens if I'm not wearing an Apple Watch on my other hand?
So we have filed provisional patents exactly around that. So we're self-funded. So if enough of these sell and there's enough interest through the Apple Watch, we're going to take that money and we're going to develop it first for the Fitbit and the Samsung. But in addition, we're going to have what's called a companion wearable, and we'll probably do a piece of hardware device. And so that's what our provisional patent covers, both the method of being able to use 2, 3, or even 4 different data points. So off of things like augmented reality glasses, off of maybe a ring, right? Another watch. But in addition, it covers as well the actual hardware if you want to do a hardware product. So it all depends on how this goes and how much people like it.
All right, well, good
luck.
Go to the App Store and download FaceAware for your watch. And
Face Touch Aware.
Sorry, Face Touch Aware.
Yep.
Right. Face Touch Aware. Thank you. That one. Fantastic. All right, we're close to the end now. Let's just have a quick wrap. So what are we expecting in the next couple of weeks? Let's start with you, Jess.
Oh, okay, great. Well, leading up to the HLTH conference, which is like a big one in the health innovation, health tech world, health. I think we're going to see, I mean, the amount of funding, like I kicked off and said, I mean, it's just, things have been just accelerated in the last couple of weeks. So I think we're going to see more of this ramp up to there. And then I think that's going to be the apex of the year until we hit whatever happens in January and don't have JP Morgan.
Missing JP. Ken.
Well, the NFL season starts tonight, and I just read today that the state of Ohio is going to help Ohio State sue the Big Ten to get college football back. So what does America care about COVID anymore?
Hang on, is the NFL going to have any fans in the stands?
They're going to allow limited fans. Like in Ohio, they can have 1,500 people on each of the 4 sides of the stadium. So they get 6,000 people a game.
Yeah, because I understand the English Premier League is kicking off, and they've done some experiments with limited amounts of fans. But you know, given that apparently a lot of this stuff kicked off at a football game in Italy,
they probably have 1,500 people on the TV crews alone.
Mike, what do you expect to see in the next couple of weeks?
Well, I think all eyes are going to be on schools at every level, primary, secondary, and colleges. The article I mentioned in The Atlantic is by Ed Young. It's called "America is Trapped in a Pandemic Spiral." And what he basically lays out is the fact that this thing is far from over, and that even though you have all sorts of people expressing these optimistic openings of different sorts, the reality is that we're in for a hard winter, and probably some difficulties extending beyond that point. And I think if there's a silver lining in any of that is if we do have a change in the executive office, that in the middle of all of that, there'll be enough serious soul searching that we'll begin to confront some of the weaknesses that the Trump administration has so generously exposed by showing us that our checks and balances in government are not adequate to protect the health and welfare of all Americans.
Oh, and it's quite a week for checks and balances between Trump's, you know, the other Atlantic article about Trump and what he said or allegedly didn't say, but what he did say about the troops. Not to mention the Homeland Security, which has just been the changing what it's reporting back, and there's a whistleblower about that, and then going obviously to the whole thing about the vaccine. Just incredible. Vince.
Yeah, we've seen a couple of surprises in the last week, and I expect we'll see a lot more, I think, is the theme I'll bring forward. You just mentioned the article by Jeff Goldberg in The Atlantic, where Trump was disparaging troops. No one saw that article coming. The book Rage by Bob Woodward, I didn't know it was coming. Maybe some people did, but again, front page headlines. And I expect we're going to see lots more stuff. In hindsight, I think Trump probably messed up in announcing that we would have a vaccine. He made the announcement, or he made the strong suggestion in August, and he was preempted, I think, by the pharma company saying, we're not going to let this thing out until we're sure it's safe. But that's the level of the kinds of announcements, many of which I suspect will also be coming out of thin air. So, watch for the BS factor.
Right. We also already had that incident in the UK where one of the people in the clinical trial AstraZeneca had some kind of incident, and they stopped that trial for the one that was like the most promising of the vaccines. So yeah, I a lot more to come of that. Robin, what are you looking at in the next few weeks?
Well, besides the Apple Watch app, Face Touch Aware being an all-time bestseller ever on the Apple Watch.
Now it's been on this show, guaranteed.
Oh, guaranteed. And we're not expecting the comet, meteor, or dinosaurs to hit until probably later in October. I'm really looking at the mental health space, because I've started seeing a lot more people talking about the mental health space as it relates to being isolated in things like the coronavirus, as well as isolated in some of these nursing homes that have been hit very, very hard. And so this is a space I'm kind of watching, and I bet you some things are going to start happening.
Yeah, those of you who follow along, Jess and I did a piece on mental health a few months back, and we're going to re-up that and do one of our little video pieces on that. But there's a lot that's been written about mental health, and the interesting interaction between sort of primary care, online health, mental health, automated healthcare is really an area that I think it's got a while to go. But just the sheer numbers of people who've been who now are reporting depression, anxiety, because they've been home alone or in a nursing home alone, or whatever, is I think an amazing area. I'm also I think I'm just stunned with the amount of news you had, and eventually I think we're going to figure out in the next 4 weeks whether we have an election that's going to be like last times, where we're not really quite certain what's going to happen, or whether it's going to be more like 92 or 2012, where it's pretty clear that one side or the other is going to win. Just when we sort that out, the fact of what that's going to do to the various government agencies and the people running them, some of whom may end up in much more interesting legal trouble than they might be expecting, including obviously the people in the White House themselves. I think it's going to have a lot of knock-on effects that are going to be potentially very, very troubling for the country, and it's going to reflect back in healthcare. And somewhere in the middle of this, we have flu season, although apparently Australians have managed to stamp out flu, and Derek Temple was tweeting about today. And somewhere else in this, we have, we obviously have the second wave of COVID. So it's going to be, I'm just not very optimistic about what the next few months are going to have. And then hopefully Mike's right, we get a change in government and have some more sensible theories about how to build a stronger national system out of it. But I'm not looking forward to getting there, I've got to tell you. All right, that is it for THCB Gang today. It's been a fascinating, wide-ranging discussion. I really want to thank all of our guests. I also, first time I've been reminded by Jess, I need to thank our sponsors. THCB is sponsored by Teladoc, Livongo, One Drop, Bayer, and some others we'll be announcing soon. I want to thank them for their support of THCB and support of THCB Gang. I want to thank our guest today, guest Mike McGee, at Dr. Mike McGee on Twitter, Robin Farfantanian, at Robin FF3 on Twitter with Face Touch Aware, a new app. Go download that for your iPhone. And then regulars Kim Bellard, Jess DaMassa, and Vince Corrales. It's Matthew Holt, your host at THCB Gang for the 10th of September, signing off, saying we will see you same time, same place next week. Bye now.